You see cold, yeah? This is pale pink, smooth and moist, normally. If you see all these signs, it means it's low conductive force is normal. And your conclusion will be low conductive force. Oh, you can put the conclusion just after the all the examination. Yeah. How to use the upper eyelid? Ask the patient to look down. Put the thumb at distance about 1 centimeter from the margin and pull it up a bit. Now you can grasp it, because in this position you can clearly grasp and don't touch the cornea because it's very sensitive, it will be rather painful. In this position, no pain, no. You should grasp not only eyelashes, but also the skin, yes, and other structures of the eyelid. Then pull it down a bit. And put the tip of the thumb at distance about 1 centimeter from the margin and around the tip of the thumb, reverse, by such a way. Now you see the inner surface of the lower eyelid and you can examine lower contractile fornix and is it painful? No. Then don't forget to... So one more time, step by step, and then will be time for check another. Ask the patient to look down. Pull up the upper eyelid, look down with both eyes on your knees, yes, grasp it. Pull it down a bit, pull the tip of the thumb at distance 1 centimeter from the margin, and then reverse by such a way. Then take the lens, because you fix with the left hand, and examine with the help of method of focal or little minute. So I think it's not enough to say anterior conductive fornices without approach. And two more methods before it's time to train. Focal, we know how to examine. We know how to examine the anterior segment of the eye, but how to examine the inner structures. The first method is called distant direct ophthalmoscopy, number 19. Position of the lamp. We change the position. It's opposite the doctor. And we use, in this method, we use ophthalmoscope. Ophthalmoscope consists of two mirrors, plane, where you can see the normal image, and concave, where you can see enlarged and blurred image, and aperture in the center. Yes. With the help of this this method of distant direct ophthalmoscopy, based on the phenomena of the red eye. You've already known about this phenomena, of course, because from time to time on the photos you see the red pupil. Yes, it's not so good for the photos, but it's very good for the patient. Because what is the principle of this red eye appearance? Yeah, light from the flash of the photo come through all the transparent structures of the eye and get the retina and underlying choroid, and there exists reflex from the fundus of the eye into the photo apparatus again, but the light changes color from white, from yellowish into red because of the reflex from the pigment epithelium of the retina, and underlying choroid consists of a great deal of blood vessels. So the color of the light is red now, and it's written on the photo film, and you see it like a red reflex. I'm pretty sure. That, yeah. Where you lie? Where you were during your hospitalization? Second floor, yes, reception near your room. Yes, and ask the nurse, they will give you. Okay. Sorry. And you know how to examine and how to explain this condition. If the transparent structures, if the inner structures are transparent, you'll see the red reflex. If there will be any opacities, small opacities, you'll see them like black spots, dots on the red background in area of pupil. But if there will be total opacity of the, for example, lens or vitreous body, you'll see no red reflex at all. So very easy. Of course, only I can see now, because only those persons who look through the aperture in the ophthalmoscope can see. Yes. So with the help of the mirror, we'll make reflex from the light into the patient's eye. Distance from the patient to the doctor's eyes should be about 20 centimeters, not more, to see clear. And now, for example, I can see the red reflex of the fundus. Look at me. I can see the red reflex from the fundus of his right eye. Now I ask the person to look up. Look down and pull up the apparatus to the left and to the right. He has good red reflex in all the position of the eyeball. Why it's necessary to ask the patient to look up, down, left, right? Because opacity is maybe not only in the center, but somewhere on the periphery. And if we turn the eyeball, we can see the periphery of the crystal lens of the vitreous body and so on. So normal red reflex means inner structural transparent. Your conclusion should be red reflex from the fundus. If the professor will ask you what does it mean, he'll explain. It means that the inner structures, crystal lens, vitreous body are transparent. After that, you check by the same method another eye, and that's all. Okay, don't forget that every person has two eyes, and so it's necessary to examine both of them. And the last for this portion of skills, number 20, indirect ophthalmoscopy. Yeah, sure.
So when we receive that red eye in the photo, if we enlarge the photo, and can we find out any spots there? Will that also mean that
it's
it
maybe,
is also
maybe.
pathological?
Of course, it's normally you can find if only if the photo, if you use the micro photo, yes, distance about 20 centimeters. From distance 2-3 meters, it will be difficult even if you enlarge the photo.
So like if I have a good camera, I take the picture from here.
Sure.
It shows the red eye effect, and then I enlarge it.
But yes, it's possible, but not during the credit test, okay? Okay, during the credit you should do like this way. But it's really possible if you want to find any changes. You can try to make a photo, but it will be not so comfortable for the patient if you use flash from such a small distance. It will be not so good for his retina. Don't forget about the patient, yes? Second, next, indirect ophthalmoscopy. Looks like the previous one. The only difference, we use the lens additionally to ophthalmoscope, we use lens 13 diopters. The focal length of this lens about 7.5 centimeters, so at this distance we put the lens, and all other manipulation looks like the previous one. And in this condition, the reflex, light rays as the reflex, they enlarged, and you'll see enlarged image of the fundus. Not only like a red reflex, but like a different structures. And by such a method, you can see optic nerve disc, blood vessels, yellow spot. Oh, such a picture like here, the fundus, yes? The fundus, yes. Optic nerve disc, pale pink, C, yes, pale pink or yellowish pink, blood vessels, arteries and veins, and yellow spot, A and B, yes. Fovea and macula. And but really it's difficult. We train our postgraduates about 2-3 months to see clear, especially if the pupil is very narrow. So during the credit, just show the technique. It will be enough. Just show the technique. But maybe somebody will manage to see the object. So 2 mirrors, plane and concave. In both methods, previous and this one, we use for reflex we use concave mirror, because in this case it's more comfortable. With the plane, you see it's blurred, yes? Especially if such a bright light from the window. If the patient look just at you, you can see the yellow spot. It's in the central part. You see. To see clear the optic nerve disc, it's necessary to turn the eyeball. Right eye here, left eye here. So like a crossing will be. If you examine the right eye, and it's necessary to check right optic nerve disc, ask the patient to look at right small finger. Look here. For example, now I'm going to examine the patient's optic nerve disc of his right eye. Now I can see it. Pale pink with sharp borders, oval, so normal optic nerve disc. When you check the left eye, ask the patient to look at his left, at your left ear, like this. Yeah, look at my left ear. And now I see the fundus of the left eye. Нет. Okay. Clear. So for distant direct only ophthalmoscope, distance 20 centimeters, and patient look up, down, left, right, and direct. Yeah. In indirect, right eye to the small finger, left eye to the left ear, and additionally lens 13 diopters at distance about 7 centimeters away, and you see try to see this. Okay, now you have time to train the previous skills and let's go for this.